take the history of your 6 minutes. You take your history from your patient, and then 3 minutes for discussion, same way as the exam. If you want to study, for example, if you want to study the seizure, you can go to July course. For those we just finished now, we had a batch before you. You can go there and watch the video. Okay? As I showed you in the Telegram group. Any question?
Hello.
Muhammad.
Yeah. anyway ما حصل لقيت باقي الشباب. أنا اسمي محمد محي الدين.
هاي محمد. محمد في جلاسكو. عملنا كويك انترودكشن. الناس ما تعرفت. لكن وي هاف حبيبه جنات موتورولا موت ودمنه ما عارفه والله.
ده يمكن أنا.
ديتا ايه اوكي. وعندنا we just waiting for فتح الرحمن and we're waiting for عمر. But I think we're gonna start with the first station. It's 8-7 already now. So محمد. Hello محمد.
ايوه
علي.
انا
Yes محمد بابكر. I will call you بابكر محمد from now.
Let me start فتح الرحمن and عمر.
They said they went to pray and they should be back. So they will be back. Yeah.
So the first station is the infective pseudoaneurysm. Who will take?
Can I ask question, Dr. Ali, before we start? Because maybe the rest of the guys here has experience on the exam, but having the exam. What the exam station about the history is going to be look like? So when we
that's exactly what we're gonna that's exactly what we're gonna practice together today. So we're just gonna deal with we're gonna treat you like you are in the exam. We'll give you the 6 minutes.
Before we go inside the room of for the history, is it? Can I know that?
No, in the history you will just have 1 minute to read the station outside, and we'll give you 1 minute also to read the station in outside.
Someone will.
Let Muhammad reply to his question. I'm just gonna.
I will be your patient, Muhammad, for this history session. I will give you 6 minutes to take this history session. Then after completing your history session, I will give you 3 minutes for discussion. After that, we can discuss and comments about the mistakes and the right things.
Okay, you're gonna understand this completely, Muhammad, when we start. So let's first start with the first station, Muhammad. And Umar is not here. Who's taking the first station is gonna be seizure. So
no, infective pseudoaneurysm. First station.
Okay. So what's her name? Habiba, are you willing to take the infective pseudoaneurysm?
No, I didn't prepare for it.
Fine. Muhammad?
You talk to me?
Yeah.
Yes.
Yeah. What do you want me to take?
Infective pseudoaneurysm.
The first station is.
As candidate or patient?
You will be the candidate. You're always gonna be the candidate. Me or Muhammad will be the patient for you.
Okay, sure.
Okay, Muhammad. Yes.
Give him the
instruction.
Yes. A 45 years old man is referred by his GP with growing lump. Suspected growing abscess. You have 6 minutes to take a history, a focus history, and 3 minutes for discussion. Are you ready?
Yes.
Let me put the timer. Ali?
Yes, I will be his patient. Don't worry. Yes.
Yes.
About 6 minutes.
Take a quick review. Okay. 6 minutes started.
Hello. I'm Dr. Muhammad. I'm one of the surgical doctor here. Can I confirm your name and age, please?
Hi, doctor. I'm John. I'm 45 years old.
Nice to meet you, Mr. John. I have some question I need to ask you about your condition. Is that okay?
Yeah, that's fine, doctor. Yeah, that's fine.
Okay, great. So, can you tell me what bring you today in the hospital?
I have this lump here, doctor. It's just bothering me and it's very painful.
Hello?
Yeah.
Yeah.
I said
Yeah.
yes. I have this lump. It's bothering me. It's very painful. Yeah.
Yeah, I'm really sorry to hear that, Mr. John. Can you tell me when did first time you noticed this lump?
It was in the last 6 days, but it started small. Now it's getting bigger.
So it getting worse within this last 5 days.
Yes, it's getting worse. Yeah.
Yeah. So this must be frustrating. Mr. John, is it this lump there all the time or comes and go?
It's all the time painful, doctor. Yeah.
Mm, It is painful. And it is fixed there all the time. It's not comes and go.
Yeah. There's some. It's intermittent. Sometimes I'll be relieved, but it's most of the day. It's painful. Yeah.
Yeah, okay. If anything make it worse or relieve
Um,
it, especially you told me there is a pain.
yeah. Nothing make it worse or better. It's just constant pain. Yeah.
Okay. Mr. John, let me ask you also regarding these issues. Uh, this lump, do you feel that like there's a pulse or beat on the lump?
I'm glad you asked that question, doctor. Yeah. There's some pulsation around this
Yeah,
lump. Yeah.
yeah. Is there any redness or sore around the lump?
Yeah. There's some redness. There's some sore around. Yeah. Around the lump. Yeah.
Mm. You told me earlier it is painful. So can you grade this pain from, from 0 to 10? 10 is worse. How much you give?
I will give it around 9. I will say 9.
Oh, this is sorry to hear that. So, Mr. John, is there any discharge from this lump?
No discharge.
No discharge. So, do you have a fever?
Yes, I have some fever.
Okay. Mr. John, I need to explore more. Sorry. Do you feel that with, straining or when you're coughing, you feel this lump increase in size?
No, no,
When you're lying flat, do you feel that it is disappeared or reduced?
no. It's always the same.
Always the same. Mr. John, sorry, I have private question. Like, are you used to inject drugs in your side?
Um, to be honest, you don't need to feel sorry about that. That's something I'm open about. Yes, I do inject myself. Yeah.
Okay. Mr. John, do you have any lump in other area in your body?
Lump, no,
Do you have regarding your weight? Do you feel that you lost weight, especially unintentional recently?
um, I'm skinny my whole life.
Okay. So what about your appetite?
It's the same. There's no
The
big
same.
difference. Yeah.
Yeah. You told me that this lump is painful and it's fixed there. I need to ask about your leg. Do you feel that there is, like discoloration or changing color of your leg or you
No,
got?
no.
Okay, perfect. Mr. John, do you have any medical condition?
Um, I have ADHD when I was kid.
Do you use any medication for this?
No, no, no.
Hmm. Okay. Any past surgical history?
I had a appendectomy when I was 17.
Okay. Mr. John, do you are you in any regular bills?
No,
Any allergy to any bills?
no, have no allergy.
Okay, that's assuring. Any any family history of similar condition?
No.
Okay, Mr. John, I have some, maybe personal question. I need to ask you, is that okay?
Yeah, that's fine.
Yeah. What do you do for a living?
I'm unemployed. I live on benefits.
Okay. Sorry for that. With whom do you live?
I live alone.
Do you smoke, Mr. John?
Yes.
How many packet per week?
1 pack a day.
Okay. Do you drink alcohol?
Yes.
How much unit per week, approximately?
30 units a week.
30 units. Okay. So, Mr. John, do you face any difficulty in climbing a stair?
No.
Okay. I need to explore some of your systems. Do you have any headache?
Time up. Could you please present your case?
Okay. I took a history from Mr. John. He's a
Muhammad,
45
you put
years.
3 minutes, right?
Yeah.
Yeah.
Continue, please.
I took a clinical history from Mr. John. He's a 54 years old male, presented referred with lump in the groin. It became progressively enlarged and painful in the last 5 days. He reported that the lump is pulsatile and no discharge. Also, he reported that he's usually used drug injection in the same site of the lump. He denied any history suggesting malignancy or uh, uh, hernia. So my leading diagnosis, this patient may have pseudoaneurysm, infected pseudoaneurysm.
What other
or
differential diagnosis you will
abscess.
consider?
I will consider this patient may be groin abscess, maybe maybe a tumor or malignancy, like from the testis with enlarged lymph node. It may be femoral hernia. It may be inguinal hernia.
And how to approach this patient?
I will approach first. I will took full history and examination. I will do full examination, abdomen and hernial orifice, including also the digital rectal examination. Also, I will start by basic investigation like full blood count, CRP, urea and electrolyte, an LFT, of course, and bleeding profile. Also, I would consider some imaging, especially he gives history of pulsatile lump. I will do duplex ultrasound, and may I consider also CT angiography with IV contrast for lower limb.
Okay. And what's your management plan?
My management plan, it's according to most probably diagnosis. If I suspect infected femoral pseudoaneurysm, I will we will start طبعا conservative treatment first. Patient, of course, he's in pain. I will give him analgesia. I will start IV broad spectrum IV antibiotic after guided by culture and sensitivity and discussing with the microbiologist. Also, I will approach for definitive treatment. It could be, exploration
Time up.
and excision.
Time up. But continue your answer, please.
Yeah. Continue.
Continue, yes.
Yeah.
Yeah, I will do exploration, excision of the aneurysm and ligation with possible revascularization later on.
What else? Is there any operative measurement you would like to consider?
Yeah, there is another option like endovascular.
Yeah, he
for
mentioned all of them, but
compression.
just all of them together. Yeah.
Yes.
Okay.
Yeah, thrombin injection or compression, duplex guided compression.
Yeah. Can you define what is a true aneurysm and what is pseudoaneurysm?
Yeah, the true aneurysm is dilatation of the vessels more than 1.5 times of the normal diameter, and usually included the three layer. The pseudoaneurysm is a collection of blood in between the adventitia, tonica media and tonica adventitia, and usually is due to penetrating trauma to the artery.
Yeah, this is the last question in this station. Very nice, Muhammad. Ali, we should start the discussion from the beginning.
While I'm doing the discussion, can I ask Muhi? Muhi, can you call Umar, please? Muhi, I don't see Umar here.
Okay, just give me 1 second. Are you hearing me?
Yes, can you call him for us, please?
Okay.
Yes,
And then
and send him the link if he doesn't have it. All right, so very good, very good, Muhammad. That's a very fantastic performance. And you are very calm. You are interacting with your patient in a very good way. That's a very good performance. And I just want to say this for you and for everyone. We're not going to say everything positive you did. We're going to focus on the negative. So whenever we come after you, don't think like I did bad. That's a pass for this station, for sure. Okay?
Thank you.
The issues I want to start with, you studied from school, right?
Yeah, sure.
We always start with open question. Tell me more about it. You didn't ask me an open question. You should say, the moment I said I have a lump here, the next you say, tell me more about it. Then I will tell you more about it. Then you ask me specific questions. All right? So start with open question. When you asked about the allergies, you said any pill allergy. The right question should be, do you have any allergies? Because you want to know if he has medical pills allergy, medications allergy, or food allergies, or whatever. Yeah, so make it general. Any allergies. Don't put your hand on your face. I know you're going to say, I'm not going to do that in the exam, but if you develop these traits, you're going to put your hand on your examiner like this on the discussion. So, and all this exam is about impression. You're just trying to impress your examiner. It's all fake. It's all acting. So don't put your hand like this. That's why everyone I asked to open the camera. Okay? Try to smile, even though it's a very serious, but smile to your patient. I know you know this is acting, but I want you to perform like you are in the exam. Like, yeah, Mr. John, you have to smile multiple times. I'm glad you mentioned your patient name multiple times, which is a very positive point in the professionalism part. When you are answering and you're trying to remember the differential diagnosis, you close your eyes like this.
Yes.
You need to stop this, Muhammad.
Okay.
So, no closing your eyes this way and trying to remember. No, get rid of this behavior. Okay?
Okay, sure.
I'm just confirming with you, while we're taking the history from you, are not looking at school, right?
No. No, this is from my head.
Okay, fine.
You know, I'm trying to I'm thinking that it's like a real exam. And this is a real patient.
And that's how you have the material. You can listen to the video in the school. You can read the material from the school. You come here to practice. Okay?
Yeah. I am trying to manipulate according to my language.
Of course.
I didn't stick to.
Yes. All right. And while you are performing, you have also the habit of adding some Arabic words, like I will start طبعا. You get rid of this one. I will start with this, or I will start with that. Or you don't say طبعا. Okay?
Sure.
Umar is back now. So what I would say, Umar, we did already the first. Otherwise, I have no point. I will let Muhammad give you some of his feedback, and then we're going to continue. Muhammad?
Yeah, very nice presentation, Muhammad. I think Ali covered all the points that I would like to mention, but I have one point regarding when you asked Ali how to score your pain, and he said 9, you should offer a painkiller. I'm really sorry, Mr. John. You would like me to prescribe any painkiller? It will increase the marks of professionalism. The other
and
thing,
usually your patient will say I'm okay, thank you, and then you're just gonna go to the next. Okay.
Yeah. And I'm so happy that you exclude the infective femoral pseudoaneurysm first, because this is your main differential diagnosis. Regarding the inguinal hernia, Muhammad, can I ask you, did you exclude it? Inguinal hernia.
I asked
Yeah. He asked me about the cuff, Muhammad. He asked me about
With the
cuff
weight,
training.
yeah.
yeah.
Regarding the
reducibility.
discussion, yes. I'm so happy that you classify your answer. When I ask you how to approach this patient, you started by, I would like to start by doing full clinical examination, which most of candidates forget this point. And then you classify your answer regarding the management or the investigation, blood investigation and imaging, because this classification increase marks of professionalism. And you mentioned the culture and sensitivity before giving the antibiotic. Very nice presentation, Mohammed. Have you any point to add? Continue.
I just want to confirm with him. How did you define the true aneurysm?
I define it as it is a dilatation of the vessel more than 1.5 times of the normal diameter or normal size. It usually included the 3 layer of the vessel.
And how do you find the pseudoaneurysm?
Pseudoaneurysm, it is collection of the blood between the tunica media and tunica adventitia, and usually it's due to the penetration injury.
All right. Okay.
Yeah. Also, there's 2 points regarding eyes. Idea, consent, yes, and expectation. You should hurry up while asking while taking your history session, because eyes markable during the exam.
Okay, sure.
Yeah. So our aim is to get all the main points, including eyes too. So I wouldn't say that eyes will take a lot of mark. I wouldn't say you will fail if you didn't mention eyes, but you're just gonna be more professional saying eyes and then systemic review. Okay. And this all the question. If there's any new question, we will let you know about it. You can, and I'm sure you know now from school you can just listen to the video, right? You know that. You can just open from school. You can just listen to the video.
Yeah.
You listen to the video, right? Just to
Yes. Now
Fine.
from the school.
Yeah.
Yes.
Should we go to the next?
Yes. For the next one, Umar is back. So, Umar, welcome back. This session was recorded. You missed the first session, but we're gonna upload it later on onto school. That was the infected pseudoaneurysm. Next one is
rectal bleeding.
And I think So, Umar, are you ready to do the rectal bleeding?
Ali?
Yeah.
Assalamu alaikum. I just want to add something, because this having an exam.
Yeah.
This person is acting like he wants to go out the station. Everyone should know that. So you need to be calm and ask him to stay at that.
Oh, okay. Yes. You reminded me of the drug addict patient we have. All of them, all the time, are outside the hospital drinking tea and coffee and gathering outside. So that makes sense. So even if your patient try to get out of the station, be calm and just ask him to stay within the hospital. That's very good point, Muhammad Akash.
You act like he's very irritable and he wants to go party or something like that.
All right.
Typically, my patient is chubby Irish lady. After 2 minutes from discussion, she said, "Doctor, I get ready for the question. If you have treatment, provide it. If nothing, I will go out."
Okay. And what did you say?
I said, no problem. Before treatment, we need to sort out what's the cause. The is very easy, but we need to know the cause of this.
And did she stay?
Yes, she stayed.
Perfect.
Okay. Perfect. Cool. Perfect. That's a very good point. Thank you, Akasha.
So, Umar,
before recording, Ali, معلش.
All recorded, yeah.
Now recorded, صح?
Yes, all recorded.
For the phrase that Muhammad mentioned, he said, "What bring you today to the hospital? Is there any short phrase? Better to gain time, I mean."
How can I help you today?
How can I help you today? And that, thank you, Fatah Rahman, for saying that. And that's always what we've been teaching. It's not what brought you to the hospital. some people think about it as a route. We never say that. I'm working here. We don't ask what brought you to the hospital. We say usually, how can I help you? What seemed the issue? Just ask, how can I help you today?
Make it simple, yeah.
Yeah.
Another thing,
Yeah.
I think we need to
I think, Dr. Ali,
Yeah.
I think this is maybe it's variation لأنه أنا حضرت فيديوهات كثيرة في اليوتيوب يعني even in native some people they said as you said how can I help you today?
Yeah.
Some people said that why you come to the hospital today?
but
Yeah. So usually, yes, I do agree. We did. That's why I didn't comment at it as wrong. I didn't say that's wrong to say that. Usually, that's what I do. How can I help you today? When I find my patient a bit off the point and he doesn't understand exactly what I'm saying, then I will be more direct of saying, what exactly brought you to the hospital today? For example, a code equine suspicion patient who's coming with a back pain and she started to give me her life history. Then at that moment, I will say, okay, Miss Ghana, just for today, why you came to the hospital? What brought you here today? So think about it as a variation, okay? We're not saying you are wrong. We're not saying that will reduce your mark, but it's just nicer and faster. How can I help you today? That's it.
yes, you can gain more seconds. You need it for another thing.
Yes.
Yes. How can I help you today?
So let us move to the next station, which is rectal bleeding. Umar Farouk, yes, I'm muted. So the scenario, Umar is a 73 years old man present with rectal bleeding. You have 6 minutes to take a focus history and 3 minutes for discussion.
Umar, yes, I'm glad you opened your camera. Muhammad, can you be his patient, please?
Yes, I can. Put the timer.
I have no access.
Yeah, let me put the timer. Yes, okay, no problem. Six minutes started, Omar.
Okay. Hello.
Hello,
I am
doctor.
Dr. Omar, one of the surgical doctor here. Can I confirm your name and your date?
Yes, my name is John and I am 37 years old.
Okay. Nice to meet you, Mr. Ali. Okay. Tell me, how can I help you today, please?
Yes, doctor. I see blood when I go to the toilet.
I'm really sorry to hear that. Don't worry. We will here to take care of you. Okay.
Okay.
I will started to question you few questions. Sorry, to understand the issue more.
Of course.
Can I?
Yeah.
Okay. Can you tell me when did it started?
2 months ago, doctor.
2 months ago. Okay. Is it started suddenly or gradually?
Gradually, but getting worse day by day, doctor.
Oh, sorry for that. Okay. Is it come and go, constant or constant?
No, it is constant.
Anything make it worse or make it better?
The time, doctor, make it worse. Nothing make it
How's
better.
that?
The time make it worse and nothing make it better. Time.
Okay. Time. Can you clarify this question more? How the time make it
Yeah.
better? Or
I meant, doctor, it being worse day by day.
Yes. Okay, no problem. Can you describe the color of blood? Is it bright red, dark red?
I'm not sure exactly, but I think it is dark red.
Okay. Did you notice any clot on it?
No.
Okay. Is it painful when you passing stool?
No.
Okay. No problem.
Why you ask me all this question, doctor?
Because I put it some differential diagnosis, I want to rule out some of it.
Okay. Continue.
Okay.
Yeah.
I will continue to ask you to rule
Continue,
out some
doctor.
of
Yeah.
Yeah.
Okay.
How your appetite recently?
But barely, doctor.
Okay. Did you notice any unintentional weight loss?
Yes, doctor.
How much? Can you
Uh,
give me a number?
it's about 9 kilos, I think.
Okay. Any change in bowel habits recently?
No,
I mean, there is diarrhea, constipation on and off like this.
no.
Okay. Do you have any mouth ulcer recently?
No, I haven't any mouth ulcer.
Any joint pain?
No, I didn't notice that.
Any fever?
No,
No, any skin problem, skin rash like this?
no, I'm not aware by all this, doctor.
Okay, that's good. That's really okay. Do you have any vomiting?
No,
Did you recently travel out of your country?
no.
Okay. Did you notice any bleeding from anywhere else?
No. Just this from my back vessel.
Okay. Did you take any medication for blood thinner, like aspirin or?
No, but my father take blood thinner medication, doctor. He takes
Why? For what?
aspirin. He have a heart condition.
Okay. Uh,
Is that
did you
related to
notice
my
any?
condition, doctor?
I will come to family history. We will go step by step in your history taking. Okay? Just follow me.
Okay, okay.
Okay. Do you have any itching or swelling around your anal?
No,
No, any pain or lump near your anus?
no, I didn't notice that.
Okay. Any mucus or discharge in your stool recently?
No.
If there any pain or does the pain improve after passing stool?
I have no pain, doctor.
Okay, that's good. That's good, really. Sorry for taking time to ask you. And
No worries. Continue.
okay, do you have any similar episodes before?
This is the first time I experienced this problem, doctor, and really bothering me. Can you help
Oh,
me?
really? Sorry for that. Okay. Do you have any chronic condition like diabetes, hypertension, thyroid, any
Yes,
condition?
doctor. I was diagnosed by diabetes 10 years ago, and I am on metformin. I think this is a medication I took. Also, I was diagnosed by hypertension. Time up. Could you please present your case?
Okay.
Both the 3 minutes, Muhammad.
Yeah, continue.
I took history from Mr. Ali. I forget the name. 73 years old, presented with 2 months of bleeding by rectal, worsening over the time. There is no constipation, no diarrhea, no change in bowel habit recently. There is a loss of weight, intentional loss of weight, more than 7 kilo in the last 3 months. There is reduce of appetite also. That's what I.
From what you said, what's your main differential diagnosis, doctor?
Until the point I reach it, going with cancer.
Is it cancer, a head cancer or a lung cancer?
Oh, GIT cancer.
GIT cancer. And what's your other differential diagnosis?
Hemorrhoid.
What else?
Inflammatory bowel disease, gastroenteritis, irritable bowel syndrome.
Yeah, that's enough. So, doctor, how to approach this patient?
First investigation.
Mm-hmm.
I will start it with colonoscopy with biopsy.
What other investigation you would like to consider?
CBC, a routine investigation like CBC, urine electrolyte, liver function test, stool culture analysis.
Mm-hmm. What
Also,
else?
there is imaging.
Mm-hmm.
Imaging like CT scan, abdominal X-ray, ultrasound.
Yeah, that's enough. And how would you manage this patient?
Sorry.
How would you manage this patient?
Full clinical examination first at all, and then I will discuss his condition with multidisciplinary team. Okay.
Mm-hmm.
And regarding the outcome of discussion, we will start with the treatment plan.
What's the treatment plan? What the exactly definitive treatment?
Is according to diagnosis. If it is colon,
What's your main
cancer
differential
or
diagnosis?
GIT cancer, mainly colon cancer.
Time up, but continue. Imagine that
Yeah.
your main differential diagnosis colorectal cancer. What's your definitive treatment?
We will start with Hartmann procedure with end colostomy.
Just like that. If your patient is inoperable.
If inoperable, we palliative treatment. Yes.
Okay, this last question, this session, Umar, very nice presentation.
Can I
You would
quickly
like to start? Yeah, you can
Yes,
start,
yes.
please.
Good, Umar. That's a good presentation. It's not an easy station. It's very common. There's a high chance you may face it on your exam. I just want to confirm with you 2 points. You studied from school, right?
Yeah, yeah.
And you were not opening the school while we're doing the discussion now? No. You didn't open the school while we're doing the discussion now?
No, no, no.
Okay.
Quick points. Firstly, as I said, I'm going to say this for the last time for everyone. We're not going to mention everything positive you said. We're just going to mention the negative. Okay? So don't feel that we are attacking you.
Yeah, yeah.
Yes. Yes. So we're just going to mention the negative. We're not going to say all the positive you did. At the start, you said, can you confirm, hello, my name is Dr. Omar. You forgot your patient name. That's fine. Create any name as you like, but just carry on the name till the end. In your discussion, you said, I forgot the name. Never ever say that. You either say the name, if you remember, or you create a name by yourself, John. I took a clinical history from John. Or you say, I took a clinical history from this gentleman. Don't ever say, I forgot the name. That's not a nice look for you within your examiner. Okay? So just say, I took a clinical history from this gentleman. All right. At the start, you said, can you confirm your name and date of birth? And then you said age.
Yes.
So it was not clear. So you should say either age or date of birth. Both of them right, but usually we say, can I confirm your name and age? Okay?
Yeah.
You said, I will start it. That's grammatically wrong, Umar. There's nothing called I will start it. It's either I will start or this or that should be started. But I will, after will, it should be a native verb. It shouldn't be started. I will start. You said it like 3-4 times, so just correct this one because it's very important and you're going to use it multiple times. If your examiner is someone who's coming from UK, this will affect your mark because think about it. You're doing an examination with someone and he say, هذا عيان مختلف صداع. Will you accept that?
No, no.
So I know all the other courses provider says grammar is not important, but that's a bullshit. Grammars are very important especially if your examiner is from UK. Okay? Can you tell me when did it started? also. Can you tell me when did it start? Not can you tell me when did it start? It's can you tell me when did it start? So some grammatical issues we need to work on. You said, is it come and goes? The right thing and is written in the school. Does it come and go? Does it come and go? It's not is it come and goes. Can you describe the color of the blood? Yes. So can you describe the color of the blood? I want to reach. Yeah, when Muhammad, some patient will act naughty with you and he will say, why are you asking me all this question, doctor? So you should calmly say, you said a long sentence and it took a lot of seconds out of you. You can just say, I'm trying to reach the diagnosis. Just like that. I'm trying to reach the diagnosis. You explained for him, you took more than 20 seconds, which affected your family, your social history, your eyes, and your systemic review. You need every single second. So instead of explaining in 20 seconds, I just want to reach a diagnosis. 5 seconds, done, and you move to the next. Okay. There's the area. Yeah. So instead of saying there is the area, when you say there is the area, you're telling me there is the area. But when you are asking your patient, you should say, is there any diarrhea? So you are not telling me there is a diarrhea. You are asking me if there is diarrhea. And when you have a question, you should start with is or are or am. Am I? Is you? Are you? Is there diarrhea? It's not is. Did you recently travel outside the country? You said. That's wrong. The right one, did you recently travel? It's not did you recently travel. Did you recently travel? Because you put it as a start, you shouldn't put the ed in the sentence at the end. And you also ask, did you take any medication? That's not a wrong sentence, that's a right sentence. But it's better instead of saying did you take, do you take? Because if he's taking a medication, it's gonna be continuous. So he's gonna be taking it till now. But when you ask, did you take medication? That means he took it in the past and done. Okay? It's not wrong. You should, but it's better to say, do you? When Muhammad tried to ask you a question, you were a bit rude and you asked, just follow me. Just follow me. So when your question, you say, just follow me to the end. When your patient asks you a question that's irritates you, try to be nice as much as you can.
He said I will come to family history.
Yes, okay, fine.
You mean it.
Yes, and I just have one issue with the pronouncing of itching. You said itching. It's just itching, and that's it. As I said in the presentation, don't ever say I forgot the name. I took a clinical history from this gentleman, or I took a clinical history from this lady. Because your examiner, 50% of your mark is the impression of your examiner about you. So always make the impression good impression. I took a clinical history from this gentleman, if you forgot the name. When Muhammad asked you what's your differential, you said it is going with cancer. And then he asked you specifically, what is cancer? Is it a head cancer? That means your examiner is trying to be irritated with you, which is not a good sign. You always trying to make your examiner happy by giving a specific answer. So instead of saying it's going with cancer, you should say my main differential is colorectal cancer. If you said cancer, there's lymphoma, which is cancer, head cancer, squamous cell carcinoma, and nasopharyngeal carcinoma. You just said, be specific. If the examiner asks you the same way as Muhammad said now, is it a head cancer? That means he's irritated. That means he's going to give you less mark in the professionalism. So be very accurate. Colorectal cancer, not even GIT cancer, colorectal cancer. When Muhammad asked you, you said, I will start it also. I will start with colonoscopy in the investigation, and we try to push you to give the operative and non-operative management. You just said Hartmann procedure, but don't forget if it's inoperable, you will do the palliative treatment. So don't forget that. Some examiners, if you said the answer as you said, if you said it's going with cancer, some examiner will not even ask you which cancer is it. You may find an examiner who's very devil, not devil, but you may find an examiner who will just give you 0 mark. for that one. And you must find a kindness examiner who will say what cancer are you talking about. So it's better to give the accurate answer from the start. And you don't have like when you say cancer, your examiner will waste 10 minutes, 15 seconds of your time, which you can use to answer another question. So why are you wasting this 20 seconds for your examiner to ask you back what cancer? No, just say colorectal cancer, okay? But overall, your performance is very good. We just need to work on this simple grammatical mistake. And also, try, as I said to, what's his name, Muhammad, try to smile also. Deal with it as the exam. Put in your mind your examiner will be mask face. He will not give you any impression if you performed in a good way or a bad way. He will be mask face. Still, you also need to present yourself as a pleasant person. Smile here and there. Don't laugh all the station, but give some smiles here and there. Oh, Mr. John, yeah, I'm sorry, Mr. John. And change your tone also. Muhammad?
Umar, I know this is your first station, and Ali appeared to attack you, but you will benefit from this point in the future. Yes. So let us review from the beginning. You should start your questions by, can you tell me more about this? This will increase the marks of professionalism. And regarding, I am so happy that you exclude the cancer first as the main differential diagnosis, but you forgot two questions to exclude this cancer, which is tiredness. And the other thing, when you ask me how many kilos you lost, I said 9. You should ask me for how long duration. You mentioned it in the discussion, but you didn't ask me during your history session. And the time didn't allow you to ask about the social history and the family history, which is a crucial points in this station exactly as it is a cancer, because I have a family history of colorectal cancer. My father had a colorectal cancer. Yes, regarding the discussion,
Another point also, Muhammad, I just want to add for you, the social history here is very important. For family history is very important about the family history of colorectal cancer, also smoking and alcohol. And this is very crucial also.
Yeah. Regarding the discussion and summary, make it easy, Umar, by mention the patient name and age. And as Ali said, if you forgot the patient name and age, say I took clinical history from this gentleman, just mention the main compliant, 2 to 3 points about the history of presenting of this main compliant, and 2 to 3 signs to support your main differential diagnosis, which is a colorectal cancer. I am so happy that you classify your answer when I ask you how to manage this patient. You said I will start by doing clinical examination. Very nice. And you classify your answer regarding blood and imaging. I have no another point. Very nice, Umar.
Thank you very much.
Let's move to the next.
The last session today is the seizure. And I think
Habiba. Habiba or Muhammad Akasha. And then tomorrow we're gonna start with
Muhi.
We're gonna start with Muhi, and then Fath al-Rahman, and then we're just gonna work in cycle.
Like
okay?
a cycle, yes.
In the same history?
Sorry?
In the same station, history taken of colorectal cancer?
No. The other station of the history stations.
Seizure.
Can do it.
The cycle, Umar. We will start with Muhammad, then Umar, and so on.
Okay, who's taking the seizure?
Muhammad Akasha, I think, unmuted himself.
Muhammad.
Yes.
Me or
fine.
Hi, are you ready for the seizure?
Yes.
Ali, can you be the patient for this station?
Yes, I can be the patient. It's a very complicated station, to be honest. Fine. Just bear with me 1 second. Muhammad, you can start by giving him the scenario.
Yes.
Yes,
Okay.
I just want 1 minute to think about it. Okay, no problem.
I will give you the scenario, Muhammad. Yeah. A 29 years old woman with non-epilepsy presents after experiencing a seizure today. You have 6 minutes to take focus history and 3 minutes for discussion. Okay?
Okay, give me 1 minute only.
Yeah.
Okay, take your time, no worries. Meanwhile, Muhammad put the timer for now.
Yeah.
So I will just add. So tomorrow we're gonna start with Muhyiddin. Then
Muhammad Jannat.
Habiba,
yes.
and then Fath al-Rahman.
Yeah.
So try to practice the sessions for tomorrow and study them from today.
Inshallah.
Tomorrow I'm on call, but I don't know what will happen.
We can give you the first station if you have a time.
No, I will try, inshallah.
Okay.
Okay, start.
Ready? Ready, Muhammad? Ali, are you ready?
Yeah, I'm ready. Put the timer.
Is it that? Yeah. 6 minutes started.
Hello, I'm Dr. Muhammad, one of the surgical team. May I confirm your name, please?
Hi, doctor. My name is Susan. I'm 29-year-old.
Very nice to meet you, Suzanne. What seems to be the problem today?
I'm already known to have epilepsy, doctor, but I just had a very extensive seizure just like 3 hours ago.
I'm so sorry to hear that. Could you tell me more about it?
Yes, I can tell you, sure. So I was watching the TV with my husband, and then suddenly I had flash of lights around my in my eyesight, and then I lost it, and I woke up with my husband touching my hand, and meanwhile I lost all the consciousness, and he said, "You've been seizing for a long." Putting in mind this seizure, the last time I had seizure was 4 years ago.
Sorry to hear that again. I would like to ask you a few questions related to your condition. You said that you have a flash in
Yeah.
your light.
Yeah.
Then did you feel like any abnormal sensation about hearing?
Yeah, I know the term, doctor. I know the term you use. You call it aura. I had that. So the same aura that I had before, I had it. Like I felt it's coming, and then I saw the flashlight, and then I'm on the floor.
And you have any,
my husband attended all of this, and he said I've been shaking like this. Yeah.
Any unusual smelling before the?
No.
During your seizure, you have blackout?
Yes, I've been blacked out, yes.
For how long?
My husband says for three minutes.
Did you bang your head?
No, he said I didn't bang my head, no.
Did you wet your underwear? Sorry? Did you wet yourself?
Unfortunately, yes, yeah.
Did you shake all your body?
Sorry?
Did you shake all your body or just partial?
No, I just wrote it myself. I just wrote it myself.
Okay. After that, did you have?
Yeah.
Did you gain your consciousness? Do you feel headache?
Yes, I gained my consciousness gradually, and then my husband drove me to the hospital immediately.
Mm-hmm. This is the first time you have this seizure?
In the last 4 years, yes, but I have epilepsy from age of 20.
Mm-hmm. So do you have any fever?
No fever, no.
So recently, do you lost? You have any intentional weight loss?
Yes, I'm glad you mentioned that, doctor. I lost lots of weight.
How much?
10 kilos.
For how long?
In just 1 month or 2 months maximum.
2 months.
I don't eat. My appetite is gone, doctor.
And you feel tiredness all the time?
Yes.
Do you have do you have any? Do you feel like you have any back pain or stiffness?
I don't have back pain or stiffness, but as I said, I'm always nauseous, in the last days. Also, I think my visual is not as normal. Sometimes I will feel numbness around my hand also. So there's something going on, doctor, to be honest.
You have any weakness in your limb?
Not a complete weakness, just some numbness.
Yes.
Yeah.
Do you have recently? Do you take alcohol today?
Not today, but to be honest, my drinking is just social. I don't think drinking was a problem for me. No.
You missed any meal before your seizure today?
No, doctor, and I have no diabetes. No.
Okay. Just I would like to ask some question about your medical history.
Yeah.
Do you take any medication?
I take
Just for
I take the epilepsy medication. Yes.
which is what you know what to take?
Carbamazepine.
You know how much it will be,
I don't know the dose, but I take tablet every morning.
every morning.
Yeah.
Are you allergic to any drug?
No, I have no allergies.
You have been admitted to the hospital before?
Yes, when I was 15 for appendectomy.
Any surgeries before?
Yeah, just the appendectomy.
Just I would like to ask you a personal question. You smoke?
Yeah, that's fine. Yeah.
You smoke?
Yes, I smoke. Yeah.
How many packs?
One pack a day.
Do you drink alcohol?
Occasionally, as I said, doctor.
Time
You already
up.
asked me.
Could you please
You
present
already
your
asked me
case?
about. You already asked me about this question.
Time up. Could you please
Thank you.
present your case?
Today I took a clinical history from Suzanne. She's 29, present with tonic clonic convulsion associated with numbness and in her hand, in her limbs, also associated with weight loss, and she lost about 9 kilos in the last 2 months. Otherwise, there is no fever, no back pain, no stiffness, no manifestation of metabolic disease. So my main differential, we have a brain tumor.
What other differential diagnosis you will consider, doctor?
Other differential, I should consider the patient may have meningitis, have metabolic causes like diabetes or alcohol withdrawal. Also, patient may have
Yeah, that's enough, doctor. What?
encephalitis also is like
Yeah. What red flags did you identify? Give me 3 red flags you did identify during your history state.
Yes, the red flags that the patient have generalized convulsion. Also, there is he's known case of epilepsy, taking medication also for epilepsy, and he will have a weight loss for the last 2 months.
Yeah, and what's your investigation?
So I would like to do start with blood test for full blood count, urea, electrolyte, and liver function test. I would like also to do imaging for CT brain and CT brain.
What other imaging you would like to
And
consider?
MRI also.
Okay. What other test?
Other tests, so I would like to do lumbar puncture and blood culture also for to exclude meningitis.
Okay, and what's your treatment plan?
The treatment plan would start with full clinical examination, neurological, focus on neurological. You start
Okay.
with patient on in Caesar. So we have I would start with airway breathing circulation. Put the patient in safety position and recovery position.
Time up, but continue.
Okay. Then we have the first line is medication. We can start with diazepam or lorazepam. The second line medication is phenytoin and valproic acid.
Yeah. How to manage patient with status epilepticus?
Patient status epilepticus is if it's long more than 30 minutes, I will focus on airway breathing circulation. Patient could have high oxygen flow.
Okay,
so
after the airway breathing and circulation, after you secured all of this, give me 3 medication with is their doses for the status epilepticus.
phenytoin. Start with the phenytoin, 18 to 20 milligram per kilogram per day.
No, I'm first line medication, not second line.
First line is lorazepam. Lorazepam 10 milligram, maximum to 10 milligram IV.
Okay.
And also diazepam 10 milligram also. Second line is phenytoin 10 milligram, 18 to 20 milligram per kilogram per day. We have valproic acid 18 to 20 milligram.
Okay, what is the maximum dose for phenytoin per milligram per minute?
Skip it.
Fine, okay, that's all right. What is your definitive treatment for this lady specifically?
Because I put the brain tumor as the main diagnosis, so after confirm the diagnosis, I would like to do discuss with the multidisciplinary team and refer to neurological surgeon and for surgical resection.
Possibly surgical resection. Good. Okay. I hope none of you guys receive this station. Very complicated station, very long station, lots of questions to ask. But I think what you've done here is very good. So if you receive the seizure, I want you to focus on the pre, intra, and post-ictal. That's the most important part. You asked most of the question. I think you forgot about the tongue biting.
And wait on himself.
Yes, this is the most too important. You forgot about. But if you receive the seizure, think pre-ictal, ictal, and post-ictal, and then ask about the differential. In the differential, you asked about stiffness, but it wasn't clear. The meningitis, you should ask me about the meningitis, saying, do you have any neck stiffness, any fever?
Yes.
You should be very specific about the meningitis. And also, you should ask me, do you have any trauma? Did you have, was there any trauma?
Recently, yeah.
Before the seizure? You ask me if I hit my head on the table, that's fine. But you should also ask me if I had an accident or if I hit my head before the trauma, okay? Before the seizure. That's also a very important question. You said recently, did you lost your appetite? You should say, yeah.
معلش انا بس هتكلم بالعربي عشان اقدر اوصل النقطه بتاعتي.
First try by English. First.
طيب.
Let's try it. Yes.
There is point from there is a logic history from or logic formation.
Yeah.
You give us during the history. She said, I watching TV with my husband.
Yeah.
If it is just like
say it.
احفظ الهيستوري زي ما هو، يعني في حاجات كده بيولوجيك ما بتيجي، يعني فهمتني؟
زي شنو؟
مثلا
محمد ما دون ستوب الريكوردينج، خليه قول لي. يعني مثلا انها هي بتحضر في التلفزيون معناها ما عندها تروما مثلا ولا كيف؟ هل ده قصدك؟ انها مثلا بتحضر تلفزيون معناها ما مستحيل تكون جات تروما.
يس. لا، ما من صياغه الهيستوري ان هي قاعده مع زوجها.
Yeah.
She was her husband and just started epileptic.
طيب تمام. عمر شفت الطب ده؟
It's normal scenarios.
لا اوكي الطب ده يا عمر انت قريت وتخرجت عليك الله في كم حاجه في الطب ده doesn't make sense. يعني
انا بتكلم عن الاكزامينيشن او الامتحان.
يلا في هو طبعا
ما في لوجيك يعني جس انا احفظ.
لا تفهم. لا انا مو مع الحفظ، انا ما بكره الحفظ ونهايه ما بقول لك الحفظ. تفهم.
انا فاهم. سوري دكتور.
اوكي. يس.
Sorry, just to be logic, يعني watching TV for epilepsy is the trigger for epilepsy.
ممكن، لكن انا هو كلام
انه ما انت تزعل عن التروما، ما ممكن تزعل عن
انه التروما وصل كده، لكن انا اوصل لعمر فهم من اللوجيكال ده. انا داير عمر يجيني في الكاميرا هنا دقيقه بس. يلا عيني يا عمر، انت the main point is you should think about the bigger picture. Okay? Let's be completely logical. The bigger picture, you are in the exam trying to impress a consultant in order for him to give you higher mark for you to pass the exam. That's the bigger picture of what we're doing here.
Yeah.
So, yeah, it may be illogical for you. She's watching the TV and then she had the epilepsy that there's no trauma. I shouldn't ask about it. But if you think about the bigger picture, you're trying to show your consultant that you know a trauma to the head can cause subdural hematoma and the patient may present with seizure or coma or whatever. You're just showing your consultant that you are not ignoring any important differential. Coming to your point, what prevents her? Let's say I'm driving with my wife and she came to the door and she hit her head on this side, temporal bone on her head, and it was a minor, and we came to the house and watched a TV.
After 3 hours.
Is that impossible? If I had a small hit like this to my head, and I am osteopenic or I have osteoporosis or whatever, let's say I have osteogenesis imperfecta, and I hit my head, and I sit there, watch a TV, that's a trigger. You cannot say that's a zero possibility scenario. There is scenario. You can you can go right and left and make a scenario. As I said, the main idea is you're impressing your consultant for him to give you, when you finish your part B and you pass it, then we don't do that in real life. I see trauma patient every single day. I don't ask all this shitty question. Let's be clear. But we are acting. You are an actor. Just remember that. You are an actor. Okay? Let me just continue the points before I forget the points for... So you said, recently did you lost... No, that's wrong. It's recently did you lose your appetite? Or any change to your appetite? Or tell me about your appetite? Or how is your appetite? All of these are right. But recently, did you lost? That's incorrect. When you say did, you don't bring it with a past verb. You also made the same mistake that Muhammad did. You said any medication allergy. You should say, Muhammad Akash, you should say any allergies, because you're also asking about nut allergy, food allergy, banana allergy. Some people have water allergy on their body. So any allergies, just like that. When you ask me, I want to ask you personal question. You didn't give me a chance to say yes or no. You said, I would like to ask you personal question. Do you smoke?
Okay.
So I would like to ask you personal question. Wait for me. I will say, yeah, fine, doctor, that's fine. That's all right. Then you ask me the personal question. Okay? In your differential diagnosis, as I said, ask more about the meningitis and ask more about the trauma. Did you hit your head before you come to the house? Do you have any injury? I want you to memorize the differential as we said them in the school, Muhammad, and classify them as we classify them in the school. All right? And I want you also to raise your voice. I want you to be clear while you answering.
While
Try
you're
to be,
asking. Yeah.
when you're asking, try to be very clear, Muhammad. I thought your voice is a bit on the lower tone. So your next station with us, I want you to raise your voice and make it very clear for everyone. Okay?
Yeah. Okay.
On the examination, you said after doing, you should say when Muhammad asks you, what is your next investigation? You say after full neurological examination, I will do this and that. And you also mentioned lumbar puncture, which I'm guessing you brought it from other sources, Salah or whatever. But it's not in the school.
Okay. Yes.
So
just-
if you have a patient with that brain tumor and she has increased intracranial pressure, lumbar puncture is contraindicated. That's why we didn't write it in the school. Okay? And meningitis is not one of your differential even. It's not the right differential. Your differential is brain tumor. So lumbar puncture is out of service. And if even you want to say it, you should say
After
lumbar
excluding.
puncture if I'm suspecting meningitis. However, this lady is more to be or is more to have brain tumor. That's why lumbar puncture is contraindicated because of intracranial pressure. And this will make you lose around 50 seconds. So there's no need to mention it. Okay? And also don't forget you are dealing with a very experienced surgeon or a consultant or whatever. So they will put you in a tight corner saying you're going to do a lumbar puncture for this patient. That will not be appropriate, okay? But overall, you're going to pass this station. It's very complicated. I didn't expect anyone to finish all the questions. It's a very long station. Just make sure you ask the pre, intra, and post-ictal. Make sure you ask about the differentials. Make sure you ask about the family and the social history. I don't think you will be able to finish the systemic or to ask about the eyes. There's no time for these two. Okay? If you've done the pre, intra, and post-ictal and analyze the main complaint and ask about the differential diagnosis and family history and social history for alcohol withdrawal, that should be more than enough. I want you later on to go to school and memorize the doses for the status epilepticus and for the phenytoin, and also put in your mind there's a difference between the first line and the second line. Okay?
Yes.
And you always start with the first line. As you notice, the time didn't allow you to even finish the systemic review, right? So you have a tight time, and it's a very long station. But overall, that's a very good performance, Muhammad.
Okay, thank you. Yes, I want to ask something.
I have question.
Yeah, before
Yes.
that,
Let Muhammad finish his
I
point.
have
and
one
then-
point. Very nice presentation, Akasha. The only thing, as we said in the previous station, you should exclude your main differential diagnosis first, which is a brain tumor. And you asked about the fever before asking about the weight loss and tiredness. Make the brain
Yes,
tumor question first, then go to the meningitis question. And otherwise, I have no any point. Just the dose of the lorazepam, the maximum dose of the lorazepam.
And the voice should be raised.
Yes.
Yes.
Perfect.
Make your voice very clear. Okay, so I think,
I want to ask some question.
of course, we will let the last minute for the discussion. Does anyone have any question relating to this one, to the seizure? Fine. Okay.
Point to just to mention.
Yeah.
As general,
Yes.
for Akasha, I think you don't need to repeat what the patient already mentioned. Ali said that I have a seizure for a couple of minutes. Last time 4 years. So no need to come back for how long the last seizure, because he give you already the information and he give you a gift second to use for other things.
Exactly, Fatah Rahman. Exactly. So the main purpose of us asking the open question is try to save our time.
Yes.
So when your patient give you information, when you ask why are you asking the open question? To save your time. So when your patient give you a lot of information in the open question, don't repeat them.
Yes.
If I gave you the onset, the character, and the radiation, don't ask me about this. Just continue about the rest. Okay?
Yes, actually, that I want to ask.
Yeah.
In the exam, when you ask what did when you give the open question, he will give you a lot of information. So no need to repeat it.
No need to repeat it. Yeah.
Okay, it's a count like you are asked for.
Yes.
Okay.
You have already the information, and this will just show your examiner that you are a very experienced clinician.
Okay.
Yeah.
Other
Second
question?
question.
Okay.
There is paper in the exam, so better to use it or skip it.
No.
Not all.
No.
Not at all.
No.
Okay.
No paper, and that's what we train you here. We train you to remember the name, to remember the age, to remember the presentation. We will discuss with you all the history, as you can see now, and it's already recorded, no paper. The only use of, I know some people say use the paper, but that's bullshit. No paper. You train your brain to take the history and then to present it. We're going to use the paper in the communication skills to draw to our patient. If you want to draw the spleen or if you want to draw the liver, we're going to use the paper on that station. But here, no paper. I know some people say...
Why no paper, Ali? Tell them, please.
No paper for 3 reasons or for more than that. Firstly, it's very unprofessional. Secondly, it will make you lose all the communication mark, which is 4.
Yes.
Eye contact with your patient, smiling to your patient, being very sympathetic to your patient. You cannot do this. And Mr. John, what's your name? My name is John. John, how old are you? 45. What do you have? You cannot do that. That will make you lose a lot of mark in the communication with your patient part. And also, depending on the paper, will help you on the long term. How? All of you are doctors practicing now. You cannot depend on this paper while you're taking history from your patient. You should train your brain to absorb all the information and present them. Okay? Muhammad, do you have other point regarding this paper?
No, I have no point. Or you mean Akasha?
So no papers.
Okay. Good point.
Okay.
Thank you.
We finished today, guys. Very nice presentation. Umar, Akasha, and Jannat, Muhammad. The next station will be, let me check from the school.
So I just want to mention, you go to the calendar, you will see all the week there on the school. You can add it to your calendar. You have session with us tomorrow, and you have self-study in the knowledge. Make sure you study this self-study on the school, and the link is already there. So next time, we're not going to send the link again. Just go to the calendar, open the date, and you will find the link there. Just press on it, and this will take you to this meeting. Okay?
And please watch this recorded session. I will upload it on the school, okay?
So this recording session will be uploaded on the same day, which is today, Tuesday. It's going to be uploaded on the day. You will find the 3 stations there, and the recording will be on top. And you also can watch the recording from the previous July one.
I have question.
Yes.
Regarding the cases in Part B.
Yeah.
When I in front of the door and reading this, like Caesar cases.
Yeah.
The exact diagnosis is constant. Yeah.
Okay, so
90%.
90 or 95% is going to be the same.
Not put in my mind, maybe it's meningitis. It's just brain tumor.
Yeah. Okay, so
and in my case is colorectal cancer. Just no.
Yeah. Okay.
Very
fine.
nice.
So 95% is going to be the same. But as you notice now, and as you notice later on, we will train you, even if they brought a new station that you never heard of.
Yes.
Which might happen, how you can process to do that station. We are not here to make you memorizing. Okay? So if your patient has no weight loss and has this patient, for example, the seizure lady, if she has no weight loss and she didn't lose her appetite and she was alcohol drinker, heavy, and stopped in the last 12 hours, then you should think about delirium tremens, which led to shakiness. Okay?
Alcohol withdrawal, yeah.
Alcohol withdrawal, yes, which will lead to seizure in 74 hours. So, and we'll even ask you questions. This is the first session. It's just نسخن فيكم يعني warm up. You will see questions that's not mentioned in different resources just to train, and it will not come to your exam, just to make you train you how to answer new questions. Does that make sense, Umar? So to answer your question, 95% is the same. It's going to be colorectal cancer, but they may change it. With you training with us, even if they change it, the investigation will be similar. The differential will be similar. The history will be similar. The discussion will be similar. It's just your differential will differ. Your investigation will differ a bit, and the management will be a bit small different. So this will not harm your mark.
Yeah. By you're already trained to summarize your case by mentioning the main compliant 2 to 3 points about presenting illness and 2 to 3 signs to support your main differential diagnosis. And also in the investigation, you will train yourself to classify your answers. So you will get 3-4 marks if it is a new station. You will not lose all the marks.
Yeah.
I think even will not be more than 2 or 3.
Yeah.
Yeah.
Okay,
Yes.
so I'm just for tomorrow, Habiba, Fath Rahman, and who's the last one? Habiba
Muhyiddin.
and Muhammad. Muhi.
Yeah.
Habiba, Fath Rahman, and Muhi. Please study the stations for tomorrow, and everyone please watch this recording when we upload it, okay?
Yeah.
دكتور كنت عايزة أسأل محطوط في الكالندر. Okay, I'm sorry. In the calendar there the time is between 8 and 10:30, so it's gonna be 1 hour like today or 2 hours and a half?
Less than this time because this is the first.
It's gonna be around the same time, yeah. Why?
He asking about the duration, Ali.
Yeah.
Because tomorrow I have.
Yeah. You have what? Sorry, Habiba?
I have work until 9. So can we delay this for half an hour or 1 hour? We start at 9 tomorrow.
We're starting at 9. Okay. Does anyone here have a problem with us starting 9 tomorrow?
No, she want to late more than this. 90 and half, 10.
No. Go. We have
Ali,
work.
her points. Habiba, her point is make this session less than all this time because we took 2 hours. Habiba did the first session.
We took 1 hour and a half, Muhammad, not 2 hours.
Or less.
No.
Habiba, when is your work tomorrow? When are you starting?
I will start from 5 to 9.
Yeah, so 5 to 9. We're gonna start tomorrow for 9 just to make sure you are attending.
Okay.
I'm just gonna change the time now. That's why I asked Muhammad and Akasha. Does anyone have a problem with 9? We will finish around 10. Fath Rahman, don't worry. I know Fath Rahman face is 10. We will finish around 10:30. Don't worry.
No problem. No.
It's not gonna be late. Fine. Tomorrow we're gonna start at 9. I'm gonna change the time now in the school. Okay?
Yeah.
9.
Okay. See you tomorrow.
Thank you very much.
Thank you.